Okay, we're going to show you how to find the neck points for neck pain, okay? You're going to want to look at your guidebook. This is a page from our guidebook. Yours may be a little different, and if you have issues with this, let me know. But we're just going to start with the basics. We're going to do the neck component only, okay? These points here. So I'm going to show you the most important thing is how to find these points on either side of the spine. They're called shoe points. So how this works, everything goes by finger widths, all right? So you have to look at the person you're treating and be sure that your fingers are roughly the same size. If they're drastically different, you have to adjust for that, okay? In the case of me and Steve here, it's about the same. So how we're going to do this is we want to kind of go up high, almost at the base of the skull. You'll come down the skull, you'll feel a little ridge here. So that's really where your neck starts. You're going to find that. What you want to do next is you put your finger this way. So think up and down. You're going to try to find a little valley between the two vertebrae. Now, up here, it's not that easy to find. They're much easier to find down here where you're going to feel this little valley. So just do the best you can. Try to find a ridge. If you're off a little bit, it's fine. It'll still work. You just do the best you can. You're going to make sure the units are on negative, okay? So right here we're on negative. Sensitivity is going to be about, 3.5 to 4 when you're starting out is going to be better. I usually do it at about 2.5, but start out a little easier for yourself. Turn the unit on, doesn't have to be all the way up. You can back off a little bit. So again, you're going to try to find the up and down valley. Then you're going to go 2 fingers off to the side of that. There's a ridge of muscles right about here in people. They call it the erector spinae. You're going to find this little ridge of muscles. That's where it's going to be. So you're here, 2 fingers off. You happen to be right about over that ridge. I'm going to show you from this side because of the camera angle. So right off the spine, 2 finger width, right about there is where the point should be. So as I'm doing it, hopefully you can see that light. As I'm doing it, we're listening for the pitch, right? High pitch is good. Light goes out is best, but as we said in the prior video, that light may not always go out, and it just depends on the dryness of the skin, the humidity. So I went ahead and I made my sensitivity more. Plus we're in a hairline area, so that's gonna affect the conductivity. So you do the best you can. You find that spot, get a good high pitch, even if it doesn't go out, and you're gonna treat by pressing the button. It's gonna beep, and you need to do that for 30 seconds. 20 to 30 seconds. I usually count about 30 beeps. The beeps aren't quite a second. You're going to be in that 20 to 30 second range, okay? So now we're going to move down. We're going to say, okay, find that next valley. A little easier to find as we go down. I feel a little valley there, all right? 2 fingers over. I should be right about there. Match that spot on the other side. This is if you have 2 units. If you have 1, you're just going to do one side at a time, or you're going to alternate left, right. Now see how here on the right, that light went out. I'm right on it. Now you can try to match it on the other side. There you go, both lights are out. I'm not sure if you can see that in the camera. Yes, you can. So both lights are out, so I'm perfectly on that spot. You see how that lives about 2 fingers right out from the spine is where that is. Same thing again, go down. You're gonna notice that spacing is gonna be fairly consistent. High pitch. As long as it's whining high like that and it's pitching high, you don't necessarily have to wait completely to go for the light out. You're on the spot, it's okay. All right, and we're gonna do that, working our way all the way down, okay? You're gonna do 7 or 8 levels, all right? So we're speeding this up for the video. So let's say that was 1, 2, 3, 4, 5, all right? Now down here is where you get into the junction of the cervical and the thoracic spine, okay? So right about here, there's ways to find this. One of the things you can do, it's a little hard to do, but you can try it. Okay, Steve, look up and look down. I'm feeling on the mountaintops, let's call them the peaks of the vertebrae. Let's do again, up and down. And a lot of people, you'll feel it's go up and down, and down. There you go. I feel this one moving and this one not moving much, okay? So that's your thoracic, all right? So in this protocol, when you look at this, you're gonna see that last dot right in the middle. See the dot in the middle? That one is actually where you wanna be. It's in the middle of the spine, so it's just under that level. So I find my ridge, and I hit that spot. So that's the last spot in the main spine area, right? You're gonna do each side all the way down, and then you're gonna find this last spot. And if you're not sure, it's not gonna hurt anything. if you're above it or you're below it. If you're not sure, you could even do all three right in the middle. Just try to find the valley. Try to find the valley between the vertebrae. That's a different point. And if you're not sure, again, it doesn't even matter if you miss it. It's not the end of the world. We're just trying to show you the ideal way to do it. So review of the main neck points. All the way down on each side, 2 finger widths out, usually going to be on the ridge of the muscle, 30 seconds each. And then the last one, you're going to find the one that doesn't move when they look up and down. And if you're not sure, don't worry, because it's hard to do even if you've been doing this for a long time. Just kind of pick, you say, that might be it. Let's pick the valley there. Ridge, valley, ridge, valley. Hit all 3. I mean, that's fine. There's nothing wrong with that. Now, the next part of this protocol includes these points here, these shoulder points, all right? So we're gonna show you them next. Actually, would you pop your shirt off, Steve, if you don't mind? So these points and if you have 2 units, hit them both at the same time. The easiest way to think of these, now the book's gonna explain it a little bit, but the easiest way to think about it is halfway between the neck and the shoulder. So think about, easier, just go here. Just go halfway between tip of the shoulder and neck. And then we're going to say right there. So it's right in the top, in the middle of what we call the upper trapezius muscle, okay? So we're going to find that in each side. Again, we're going to search around a little bit, try to find that highest pitch, and if the light goes out, even better. Now I can see right light went out. I can say, well, now why don't I adjust and try to match that spacing visually? See, now it's pitching higher, and that's good enough. We're going to treat there. Do our 30 seconds. Now the next one, a little harder to find. We don't have that real clear landmark. Just drop all the way down to what we call the spine of the scapula. So you're going to feel a bone sticking out, the shoulder blade. You're going to feel this bone sticking out. So drop all the way down, just be on the top of that bone right there. Find that spot. Same line with this, kind of in line with that other point. Nice thing about doing this, you can see where you were before. It leaves a little depression. So go all the way down, say, okay, right there. Again, try to get it to pitch high if you can. High as you can. If the light doesn't go out, it's not the end of the world. I wouldn't, waste a minute or 2 or 3 trying to make the light go out. As long as it's pitching high, you're okay. Now the last point is right between these. And you see how, it leaves the depression. Sometimes leave a little red mark around it. It's always temporary. It's just the way the body's reacting to that. You find just the middle of those points. Just eyeball the middle and treat there. And that's basically the entire, what we call kind of the core neck shoe point protocol. Now, clinically, we usually just do these neck points. If you want to enhance the effort or the effectiveness, you can do the wrist points I showed you in the last video. You remember those 3 that we did 1, 2, and 3 fingers down was 3. You can do those before. You can also use the rest of this protocol, and you should have a similar protocol in your book. If not, let me know. You can also hit this little point here, which is where if the hand is bent, it tends to live right in this little crease. You just kind of drop it in that crease, and you come up and you treat there. So that's another point that can enhance the effectiveness of this. And then there's a couple different points in the wrist, and then this point here right in the middle of that fleshy mass between thumb and finger. And then there's a thumbnail point, and you can even go down to legs, because again, this is where you get into the acupuncture side. You can even go down to legs and find this one on the outside near the knee, and then outside above the ankle. Your manual should give a similar explanation of how to find these points, okay? And I realize it's probably backwards on the video, so if you have trouble with that, let me know.